Hi, this is Eric from Iron Body Studios. Today I'm going to talk about positioning and getting ourselves set for what we call a 90-90 sit. And this is to help work on our opening up our hips, both working on external rotation of one hip and internal rotation on another hip. So this comes from the Functional Range Conditioning by Andrea Ospina, so you can go to his site and really get dialed in. But I'm going to give you as much detail as I can, getting you set up and working on your 90-90 sit to increase both capsular mobility and muscular mobility, so both aspects of the hip joint. So first of all, getting yourself set up, you should have your front leg with your thigh pretty much straight out in front of you, and we call it a 90-90 because this front knee is at 90 degrees. And then this back leg, the knee is at 90 degrees, and I'm out. I try to be completely off to my side. You don't want to have the knee too far up here or way too far back. Just get it comfortably out to the side. So now I'm 90-90 for my sit. Now you see I have a little kickstand out here. I'm giving myself a little support because it might be hard to hold yourself up. So always spot yourself in these positions while you're working so that you can make sure you have really great form and you're hitting the tissue and the target of the hip that you really want to be hitting. So first off, we're going to go capsular. So with this, I want to think about staying really tall and then thinking about taking my chest and taking it out to hover over top of my knee. And I'm also thinking about pushing my tail back. I don't want to curl under like this or tuck my tail. I want to think about staying long and tall. So I'm really trying to extend the spine and stay in that position. As I extend, I bring my chest towards you and I lean, so my belly button or my chest is now going towards my knee and hovering. Now, I hold this stretch. You're going to feel a deep stretch on the underside of your hip. If you feel a pinching or pain here, then you need to find a medical professional, physical therapist, functional range release practitioner, somebody to help you work on that capsule, because there's probably something going on with your capsule here on the upper side when we're trying to work on the lower side. You should always feel the stretch on the opposite side. So I'm nice and tall. I'm leaning over. I hold this stretch for about 30 seconds. I'm going to shorten it as I go through this so I can get through it. So I'm going to stay tall. I'm going to lean out over my knee. Then the other aspect is I'm thinking about pushing from my knee to my ankle, my shin, the bottom side into the floor. So I've held this stretch, and now I want to bring a slow ramp up into pushing my leg into the floor. So I bring 1, 2, 3, and I push my leg into the floor, and I'm pushing and pushing and pushing. I push for about 15 seconds, and then I ease off, relax, get taller, and come out over top of that knee a little bit more. So there is my capsule aspect. I usually do that 3 rotations times through. Okay, so 3 times through. The next aspect is I'm going to think about actually collapsing. So now I'm pulling from my hip, I'm spotting myself, and I come down into this position, and I'm letting my chest come over top of me, and I let it collapse down, and I let my back curve, and now I'm sitting in this hip, and I have a nice hip hinge here, and I'm working more of a muscular aspect of this 90-90 sit. So get as much of a stretch as you need. You can spot yourself with your arms, okay? I hold this stretch, same thing, for about 30 seconds. Once I hold it, then I think about, once that 30 seconds is up, I want to push this leg into the floor again. So I'm pushing into the floor about 30 seconds, and then I relax. And then I take the stretch a little bit deeper. So you see how my chest just came down to my knee a little bit farther. So I hold that for about 15 to 30 seconds. I'm breathing through my belly, always diaphragmatic breaths. I breathe in, I get tight in my belly, and then I get tight here, and I think about pushing this leg into the floor. I push, 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 and then I relax and just hold that stretch. Now we're going to add a dynamic portion to it. So on this time, I'm going to get tight, push into the floor, take a breath in, push into the floor, and now I'm going to push myself nice and tall. I push up, and get tall. Now I pull with this hip and pull myself back down, controlling down in, and push. And pull down in. You may need to use your hands on this. That's fine. It took me about 3 to 4 weeks to be able to go without my hands. And then if you need to spot yourself coming out, it just looks like this. Spot yourself, and then get nice and tall. To go to the other side, we just rotate down. Think about pulling your hip down to the floor, and I hold that position. And then relax out. And then I pull down in and relax out. That's working your internal rotation. To do the other side, we just switch the legs, get yourself set up, and then we work through the capsule and then the muscle. Okay, so there's our 90-90 external, internal rotation sit. Work both sides. Practice this into your training. Increase your hip range of motion and enjoy the new degrees of freedom that you're creating into those hips. All right, if you got any questions, I'll be sure to answer. Thank you.